4CRB.
And a very good morning to you. Welcome to our Ask the Doctor for this Friday. And as we've been telling you all morning, we have a special edition of Ask the Doctor this morning. We have DrBen Jansen with us. Dr. Jansen is a general practitioner who is also authorised to prescribe medicinal cannabis. And we're going to have a chat with Ben this morning. Good morning, Ben.
Good morning, everyone.
Yes, and whilst there is a lot to talk about in discussing this very interesting topic, medicinal cannabis, it is a talkback program, and if you have any issues of a medical nature, you are welcome to give us a call. And that hotline number for you to call is 5520 8888. We would like to hear from you. Now, Ben, firstly, so we can start off on a level playing field here, could you take us through and position the two, recreational cannabis versus medicinal cannabis? And I know that subject would probably take more than what time that we've got here today, but can you give us an outline of positioning it for us?
Well, basically, recreational cannabis is what people use to have a feeling of euphoria or relaxation, whereas the medicinal side of things, you're looking to treat a condition generally. But it goes back a long time in history, back 4,000 years, where cannabis was used both in a recreational sense by the Greeks and then subsequently by various cultures for a medicinal purpose. If we go on until the late 1890s, it was studied extensively through William O'Shannessy in India, and the hemp, I can't remember the name of the actual document there, study that they did there was a large study with about 2,000 pages of report in it that came back with various studies across India that showed that it was quite beneficial medicinally. And up until 1920, it was the most prescribed medication by all doctors. And then it was banned due to various reasons. And the American Medical Association at that time actually had the government of America up against the wall and tried to fight this because it was such a useful drug and quite safe. But they eventually failed. And through the last 80 years, there's been a lot of stigma attached to it, a lot of politics, and a lot of misinformation through the Nixon era and into the Reagan era about various effects of it. Interestingly, it's still a lot of stigma attached to it, and there's still a lot of misinformation. People out there seem to think that cannabis will fry brain cells. I heard that just the other day from a doctor, when in fact the US government currently holds a patent on cannabis as a neuroprotective agent, so as a brain protector, which when I first found that out, I was just absolutely amazed that I've been told all these years that marijuana or cannabis was bad for your brain, but in fact it's good for your brain cells.
And that would probably be a key point of difference from the community's point of view, that it's bad because of this suggestion that it does some neurological damage.
Exactly. I mean, there's a lot of false information that's been put through by the politicians over the years, and that's just one of them. The other one is that I keep hearing is that marijuana causes schizophrenia. Well, that's subsequently been shown to be not true. Very large studies of over 100,000 people have shown that it doesn't cause schizophrenia at all. And those that are susceptible to schizophrenia, we don't give THC because it can unmask their existing schizophrenia, but it in no way causes it.
Ben, in terms of the natural plant, how many chemical compounds are in cannabis?
It's a really interesting point you bring up there. People think about marijuana and they think about people getting high, and that's the recreational side of things. That's that THC, the THC that binds in the brain, and it's a down regulator of the nerves. Yes. But it's like tomatoes. There's so many different types of tomato plants out there. When you think about cannabis plants, you have a range of different types of plant that produce different types of cannabinoid in them. And the two most interesting ones that we prescribe for are the THC and the CBD. The THC, the one that binds in the brain, is a down regulator that can turn off pain, anxiety, etc., versus the CBD, cannabidiol, which works mainly in the body on the peripheries and is an anti-inflammatory. It's an anti-anxiety agent. You actually use it for schizophrenia. It's a brain protector, liver protector, heart protector. It's quite a unique molecule, and that has such a wide range of beneficial effects. And that CBD in no way gets a person feeling stoned or high or in any way inebriated. So the CBD is what we're prescribing a lot of at the moment because there's no issues with driving, etc.
Terrific. So we've gone from many hundreds and thousands of maybe years ago that this plant was being used as a natural healer in terms of usage to a conflict between governments around the world that suggested that it wasn't good for us, and they've legislated against it. And the tide seems to be turning now, such as having practitioners around our country, such as yourself, that are now able to prescribe it. And that seems to be opening up the thinking around cannabis, medicinal cannabis, being a part of our treatment protocol.
Absolutely. You look overseas, we're probably 10 years behind Canada and the US with regard to thinking about this sort of thing. You look back in time, Queen Victoria used to use cannabis for menstrual pains. We're now in 2019 and we're starting to change things. But you say that I'm the only one that can prescribe it on the coast. I'm not the only doctor on the coast.
No.
In fact, the legislation has changed that any doctor can prescribe it now.
Oh, right. Okay, fair enough. That's good. And your homeland, New Zealand?
Yes, born in New Zealand.
Yes, and next year they're actually having a referendum.
Yes, a recreational referendum, and
yes.
I just having a look on Facebook last night. Oh my God, the pollies are out there. They're throwing mud each way. But at least there's some sensible debate in some of the areas there.
So it's going to put pressure on our country, Australia, if that referendum is passed with a yes. That'll certainly put pressure on us as well to look at the whole question of cannabis use.
Yeah, certainly medicinal is here, and it's here to stay. And
yes.
in the future, once the larger trials come through, I think you'll start finding it being funded on the PBS and become part of mainstream medicine because it's so uniquely safe, and it's safer than paracetamol. CBD is safer than grapefruit, in my opinion.
Okay.
And then the recreational side of thing, I mean, there's various debate on that, but I think a regulated market is the best way to keep that out of the hands of children.
Okay. All right. Look, thank you, Ben. We'll be back. We'll go to a short break. Hey, this is your program as well. We don't want to talk all the time. We'd like to, but look, you can give us a call. How about telling us your opinion on the whole question of cannabis, particularly in the medicinal area? And give us a call now on 5520 8888.
Harvey Norman Tweed makes race. Ripper deals still alive. 15 to 25% off a huge range of computers, including Microsoft Surface Pro and laptop. 10% back in Harvey Norman gift cards on all Samsung electrical products. TVs, soundbars, fridges, washers, vacuums, and more. Up to 40% off lounges, dining and bedroom furniture. Up to 50% off mattresses, ensembles, Manchester and outdoor furniture. Up to 30% off carpet and flooring in-store. Savings off normal ticketed prices. Exclusions apply. Hurry, makes race. End Monday at Harvey Norman.
A sponsor.
Did you hear about Jane?
No.
She just moved home care providers.
Really? Why?
Well, home care assistants have no out-of-pocket expense and they're government accredited.
Sounds like a smart move.
And she gets to choose her own caregiver with no contract, no out-of-pocket expense, plus 24-hour care support.
Wow. More for less, hey? How can I contact them?
Home Care Assistance Gold Coast are the home care provider you can trust. Call our sponsor on 55281 643 and make the move today. And you're with Ask the Doctor. This is a special edition of Ask the Doctor. This morning we have Dr. Ben Jansen with us, and we're talking about medicinal cannabis, of which Dr. Ben, there you are. You've been tagged now.
Dr. Ben,
It's Dr. Ben from here on in. That Ben is currently prescribing in the region here. There's a lot of questions to be answered there, and he'll explain a few of the conditions that medicinal cannabis is being used in. But this is your talk back, and the number is 5520 8888. Ben, before we go to our next little bracket, I think we've got a couple of callers. Our first caller here is Jeanette. Good morning, Jeanette. Jeanette, are you there?
Yeah, I'm here.
Like to have a chat with Dr. Ben?
Oh, yes, please.
Okay, he's yours.
Oh, thank you. Hi, Dr. Ben.
Hi there, how you doing, Jeanette?
I'm fine. Very, very, very curious about this because I've got glaucoma and I've done some research on this cannabis. Obviously, it's not legal, so you can't sort of say too much, or so I've heard. Wondering, can it help at all with the glaucoma?
In the past, there has been some studies that showed that it did work for glaucoma, but subsequent studies in recent times have shown that it hasn't worked that well for glaucoma. It's not something that I would recommend because the current standard medical treatment for glaucoma is reasonably sound.
Yeah, I know I've got it. I've lost the sight in one eye because of it. But is it good then? Okay, that's fine. I've done a bit of research on it. Is it any good for arthritis?
Arthritis, absolutely. There's different types of arthritis. There's osteoarthritis, rheumatoid arthritis. It works very well for rheumatoid or inflammatory arthritis, and that's the CBD. That's the stuff that doesn't get people high. It's non-intoxicating. For the osteoarthritis, it doesn't work as well, but in saying that, it depends on the person, and we never know until we put someone on it whether it's going to work, because sometimes I'm a bit dubious about an osteoarthritis patient getting an effect from it, but then they go off and they try it, either the CBD or follow up with the THC, and they get a really positive response, and it's variable on the person. But
this CBD and the
THC,
the other one.
Yeah, that's the one.
What, can you just quickly explain the difference? I know you have already, but I'm afraid to take it. You don't take it orally, do you? You just rub it in your hands if you've got arthritis, or rub it on the sore part of your body, or...
The vast majority of medicinal cannabis comes in either oils or capsules, and it's oral. The CBD, you take as an oil twice a day, usually, unless it's certain types of inflammatory conditions, and that's 4 times a day. But that in no way inhibits you from driving. You won't feel high or sedated on that. The THC is a separate molecule, and the recreational cannabis, that's been bred into that. So the plants that they use for that, that can make someone feel sedated in a high enough dose.
What was the one then? Years and years ago, I went to my place and had these chocolate cakes, and totally innocent, of course, very young, know nothing about cannabis. And they'd put some stuff in these chocolate cakes, and I felt quite weird. And they told me afterwards it was cannabis.
That was probably the THC in it. So
I don't want that ever again.
And most of the people that take the THC, medicinal THC, they're in no way high. You have to have a certain dose before you start to feel sedated or high or inebriated. So the people that take it for our medicinal cannabis are taking multiple small doses so that they get rid of their pain, but they're not feeling high.
Right.
I mean, people come in and sit down in my chair and they say, we talk about the THC, and they say, well, I don't want to be high. And I say, well, I don't want you to be high either. We want to get rid of the pain. So multiple small doses specific for the person. I always say, treat the patient, not the guideline.
That's right.
Hey, Jeanette, I'm going to have to ask if we can move on. I've got a lot of callers on the line there.
I appreciate that. Yeah, thank you so much.
And thank you. Thank you very much.
Thank you.
Thank you.
Good morning, John. John, are you there?
Yes, I am, yes.
Have a chat with Dr. Ben.
Morning, John.
Good morning, Ben. How are you?
I'm great, thanks.
That's good. I'm currently watching with interest the Israeli trials into CBD, THC, and autism, due to the reason that I've been treating my teenage son, who has quite profound autism, for a couple of years now, using both CBD oil as a base and the THC CBD tincture that I make. And some of the changes in those 2 years have been quite profound, particularly with regards to his behaviour. So, that's my anecdote.
I agree with what you're saying there, absolutely. And we have patients with autism as well. And as you will be aware that autism is a broad label, and with autism you've got all sorts of anxieties. And so a lot of the time I think that we're treating the anxieties that are associated with autism. So the CBD working really well for our autistic patients. And then as you were saying there, just adding a bit of THC on top, just to have a calming effect on the brain, because it is down regulator of nerve cells in the brain, so that if there's overfiring or you're really anxious, it's going to turn those nerve cells down a little bit.
Yeah, we noticed a key improvement in the area of lessening of violence. So we were having situations sort of 18 months ago, 2 years ago, where there was daily violence that was occurring, and the CBD has virtually eliminated violent outbursts. That's one a month now. Sleep has improved, and mood has certainly improved. We've also noticed a tremendous lessening of OCD and anxiety. So, I think you're right. We are 10 years behind some other countries like Canada and the US, and we need to get with this a bit more, because the therapeutic value is irrefutable from a parental anecdotal point of view anyway.
Yeah, and it's a bit sad that we have to stigmatise people, and you're trying to protect your son and do the right thing by you, but the law is still lagging behind.
Correct. Yeah, I need to hide capsules and relabel things, and make them smell proof and all that sort of thing. But So what was your last name, Ben?
Ben Jansen. You can look me up on the internet there. I'm working out of Medical on Miami. Brand new clinic, 5 stories, beautiful, family owned. Yeah,
I'd be interested in touching base with you. You seem a little bit more,
a
little bit more up to date.
And John, you can check out the website Medical on Miami and get all the details.
All right, I will do. So thanks for your time, Ben.
All right, all the best.
Bye. Good morning to Michael. Michael, have a chat with Dr. Ben.
Morning, Michael.
Good morning. About painkillers, like you said, any doctor can prescribe it? They
can. They have to do a special application to the Therapeutic Goods Administration, the TGA. It takes a little bit of effort on the doctor on the first part, but I'm more than happy to teach your doctor to do it and show them the right way. If you go to our website, I have instructions for doctors there how to use that website so that they can access it. That's cdaclinics.com.au.
And have you got a phone number for your office, or?
Absolutely,
yes,
which I never remember because we've only just moved in there.
I've got it here, Ben. It's 5576 5832. That's Medical on Miami. You got that? Did you get that number?
And if you look up medicalonmiami.com.au.
5832.
5832. That's it. Yeah.
Yeah, because I can call back and talk about the pain later.
All right.
We'll see you there.
Okay, terrific. Thank you for your call. Next up we have, is it Shoko? Shoko?
Yes, hello, good morning.
Good morning. Have a chat with Dr. Ben.
Good morning.
Yes, good morning, Dr. Ben. I got the half answer on a lady that asked about the arthritis. I have the arthritis that sort of, I have the knobs on the fingers, and I have the sore knee, which one doesn't agree on the walking. So what I'm interested, if I go on that medication, how can I travel with it, or do I get in trouble?
Yes, so I hear that you got a sore knee that you'd want to take it for. You can travel all around Australia with your medication. When it's sold as a medicinal product, it's medicinal. It's from us.
Yeah,
it's been tested by the TGA. It's approved. If you're going overseas, you have to check on the countries that you're going through. So CBD in most countries is considered a medicine. THC is considered a medicine in New Zealand, Canada, most of the EU. But if you were to go to the USA, it's still considered a restricted substance. So you just have to check where you're going with your THC and CBD.
Well, mainly Europe anyway. But anyway, I can ask my GP to him to describe this medication for me. And,
yes, they can describe it.
Least,
or
yeah, and
if they're really unwilling, then get them to refer through to myself, and we'll help you out there.
Okay, thank you very much.
No worries. Have a good morning.
Good morning. Thank you.
Yes, thank you for your call. Next up, we've got Charlie. Charlie, good morning. Charlie, have a chat with Dr. Ben.
Yeah, hi there, Dr. Ben. It's Charlie here from Brisbane. How are you doing?
Hi there, Charlie. How you doing?
Yeah, not too bad. Look, I've got chronic pain in my shoulder from playing rugby a few years back. And I had a look at some clinics up in Brisbane who said I'd qualify for the pain, but it looks really expensive. It's like $400 for a consult and $400 for the products. How much is it costing with you guys, and what's the process?
If you come through us, we can charge through Medicare at the clinic, so you do get a Medicare rebate of $71. It is a labour-intensive first consult. It takes us about half an hour to do the application, so there's a $200 charge for that, and then subsequently we're only charging $50 for repeat scripts, and you'll get $37 back. The products depends on how much you're using each day, because each person's a little bit different, and we're averaging on between, at the very least, $3 a day, up to $10 a day, depending on how much a patient needs to use with regard to the product. So all up, if you're looking at $5 a day, $150 a month. Hopefully the PBS will come to the party in the next couple of years and start funding that.
Okay, and how long will it take, so if I was to come down and see you and have a consultation till I get approved and stuff, does it take a while?
And so the powers that be have allowed us to do some fast track approvals. Chronic pain is one of those, and the most common thing that we prescribe for, and usually that comes back with an approval within 24 hours, and then we can then prescribe. So my record is actually 3 minutes. There happened to be someone at the other end of the computer, and they approved us, and I was looked back and we were approved, and whoa, actually here you go, here's your prescription, take that downstairs to the pharmacist and he's going to order that and dispense it for you. So we usually say, look, 48 hours is our best. Yeah, up to a week if the government's just dragging their heels. They're not bad people in the government. They just have to, tick the boxes.
Okay, that's not bad. And what was the name of it? CDA? Did you CDA?
CDAclinics.com.au. That stands for Cannabis Doctors Australia.
Okay, great. Thanks very much.
Or you can contact Dr. Ben through Medical on Miami as well.
Medical on Miami. Yep, no problems. What was that phone number again? Sorry.
That phone number again is 5576. 5832.
Great, thanks very much.
Thank you for your call.
Thank you, Charlie.
Good morning, Carmen. Carmen, have a chat with Dr. Ben.
Hi there, Carmen.
Hello, yes.
Hi there, Carmen.
Hello. Yeah, hello, doctor. Look, I just want to know, I have a lot of chronic pains and I know pain, and I would like to start with the CBD, whatever. If you drive, if you get stopped by the police and they do a drug test, is there any problem?
With the CBD, it's not tested for at all. It's not a restricted substance. You're allowed to drive with your CBD. And so most patients choose CBD because it's not going to stay in your system for a period of time. So it's not going to come up in a test. It's absolutely fine. And you mentioned that you're using Norspan, which is an opiate.
It's opiate.
Yeah.
Yes, I know. That's what
you get those side effects from that, don't you?
Yes.
Yeah. So
that's what I would like.
I find it very, and I want to say heartening when I have patients come back and they start stopping the opioids and start getting rid of those side effects, and we're doing that just with CBD, which is I've had 5 patients stop their opioids completely within the first week on CBD, which I was just astounded by. I thought they were going to need some THC on top, but no, just amazing.
Oh, that's a good news. And you're in the Miami Medical Center, is it?
Yes, ma'am.
West Street, is it?
That's Gold Coast Highway. It's just south of Miami High School.
Miami High School. Okay, thank you very much for your help.
No worries, thank you.
Bye-bye.
And it's a good morning to, is it Georgina?
Yes, it is.
Good morning.
Have a chat to Dr. Ben.
About 4 years ago, I was diagnosed with fibromyalgia, and I'm in constant pain.
I'm sorry to hear that. I love having fibromyalgia patients because they respond so well to the CBD. There's a study done a couple of years ago on patient reports, and it was a 95% positive success rate with fibromyalgia patients.
Okay, now what about so I would definitely qualify
Yeah, absolutely. Fibromyalgia patients generally, you've 3 months of any chronic condition that's lasted more than 3 months that hasn't responded to standard medical treatment qualifies. So that's a lot of things, and fibromyalgia is right in the middle of that.
Okay, that's good. Yeah, because the pain can be quite horrendous at times.
Yeah, debilitating. So I would love to see you and help you out.
Okay, I'll make an appointment.
Fabulous. Thank you, Georgina.
Thanks, Dr. Ben. Bye-bye.
Thank you.
Well, I think that we're going to have to get together again, Ben. We've got a lot more to talk about in this subject. It's quite amazing. Those people were had all individual questions to ask. It's a big subject, and I can promise our listening audience that you'll be back again, and we'll have this topic discussion. We'll continue with the discussion about medicinal cannabis, and also just a quick mention for Medical on Miami. For everyone who doesn't know, it's a multi-service practice. There's some 10 GPs there. You've got pathology, radiology. There's a pharmacist on site. It all happens.
And don't forget our lovely physios upstairs.
And the physios upstairs. And the gym is absolutely magnificent for repatriation type programs as well.
And a quick word to the dietitians out there.
Oh, well, look, they're all there. Dietitians as well. This is Medical on Miami at 2125 Gold Coast Highway, just south of the Miami High School. That's the one. Ben, thank you for giving us the time this morning. It's been a real pleasure and a very interesting topic.
Thank you to the listeners. Thank you to the callers.
Thank you, Ben.
Good morning.
Bye.